Cloud. All right, so we are live and good to go. Good morning, everyone. Welcome to the 2021 open enrollment season. As I've mentioned before, some of you may know that we are changing our healthcare provider from Harvard Pilgrim to Cigna. Today we have Bill Bald here with us to go over our new plan. Bill is our broker from Melcher Prescott, who handles all of our negotiations for our plans and helps make sure that we are getting what's best for our employees. So with that, I will turn it over to Bill.
Thanks, Angie. And just a little background, we typically start working together on reviewing options for the team to try to find most cost-effective, best solution. This year was a little bit of a tough year with Harvard Pilgrim. Claims were a little high, but we did find a really nice solution through Cigna. As Angie and I have discussed, it's sort of a grown-up plan. Cigna only works with larger employers, that is defined as over 50 in the state of New Hampshire. But we're going to find some really nice enhancements this year to your plan. And I'm going to run through those in the open enrollment presentation. I've tried to put together a quick comparison of your Harvard Pilgrim plan versus your new Cigna plan, which will be effective the first of the year. The networks under the Harvard Pilgrim plan have either been a limited New Hampshire network under the Elevate Health plan or a New England network under the LP plan, and that was the buy-up. With Cigna, you guys will have a national program, so you're free to see any Cigna provider nationwide. Cigna does contract with every hospital organization in New England and about 97% of the hospital organizations nationwide. So if you needed specialty care, the best doctor in the world is at Johns Hopkins in Baltimore, you're free to go there. So really nice as far as scope of coverage goes. Your primary care copay is going to be going down from $40 to $25 this year. So a little bit of a savings there. And your specialist copay is going to be going from $80 to $50. One of the things with visits to a specialist, under the Cigna plan, you no longer need a referral. So you do not need a primary care doctor referral to go see a specialist. So, if you've got some tennis elbow or something like that, and you want to go see your orthopedic doctor, you're free to do so. And you don't have to clear through your primary care doctor. Next piece would be the emergency room urgent care. We're going to encourage everybody to continue to utilize urgent care when possible. It saves your plan a lot of money and it will save you a lot of money. But in particular, both of your Harvard plans, emergency room was subject to your deductible, and that was a $4,000 deductible. Emergency rooms bill on a per minute basis. Full disclosure, I'm vice chair of the board at the hospital. It's very, very expensive to get your care in the emergency room. If you under Cigna, that will just be a $250 copay. So if you've got chest pain and need to get to the emergency room, get there immediately, but it will just be a $250 copay instead of being subject to that $250 deductible. Your urgent care is a $50 copay. Whenever possible, we're going to encourage you to take advantage of either Clear Choice or Convenient MD. These facilities tend to be really good for things like stitches and x-rays, colds, COVID-19 testing, really cost-effective solution. I know the facilities right now are a little busy with all the COVID-19 testing, but typically you can get in, you can register beforehand, get in about 15 minutes. I know they're running a couple hour lag time right now, but a very nice benefit that will be available to you. Additionally, Cigna has their telehealth benefit, which you'll get information on that once you enroll in the plan, where your maximum copay would be a $25 copay. It might even be $0 or a $5 copay, depending on the billing code. So if it's a weekend, let's say you've got a cold, maybe a sinus infection, those type of things, you can do a live telehealth visit with Cigna. Have your appointment right over the phone, and they will call in your prescription for you to your local pharmacy. Really easy. You don't have to go into the doctor's office. You don't have to worry about whether the convenient care facility is open. This will be available to you 24/7, 365 days a year. So you'll see some more information once your Cigna ID cards come through. But once again, a really nice little benefit. Your outpatient surgery benefit under Harvard, you did need to go to what was known as their LP or low cost providers. Under Cigna, outpatient surgery, regardless of where you have it, is just going to be a $250 copay. We'd encourage you to utilize the freestanding surgical centers like Hillside here in Guilford, or if you go down to Concord Ambulatory Surgical Center, Bedford Ambulatory Surgical Center. These things are popping up all over the place, but a real cost-effective option for day surgery. If you look at the outcomes from these facilities, they tend to be a lot cleaner than a hospital situation. Looking at national averages around post-surgery infection, it's a really great option to go to a freestanding surgical facility as opposed to a hospital setting, but hospital settings would be included for you. Your deductible, will remain at a $4,000 deductible. A lot of times you question what applies to the deductible. That would be your typical inpatient hospital stay. It might be an ambulance or air ambulance. I know locally we fly a lot of people up to Dartmouth Hitchcock when things are serious. I can tell you that flight starts out at about $38,000 for 20 minutes and goes up from there. So not an inexpensive ride, but those type of things would be subject to your deductible. The other things that are subject to your deductible would be an MRI or a CAT scan. One of the things you'll find is there is a huge variation in price in these diagnostic testing pieces. I'll use myself as an example, and Cigna does have some tools that'll be available to you through member services. But back in September, I needed an MRI on my calf. I had torn my calf muscle, didn't know if it was the calf or the Achilles tendon. MRI in Laconia was going to be $2,300. If I was willing to drive to Concord Ambulatory Surgical Center, it was right around $500 for that same MRI. So I'd encourage you guys to utilize the tools available through Cigna. They have the contracted rates for providers, and being able to take advantage of that, you can save a lot of money for yourself. After your deductible, your medical expenses are going to be covered in full. There's no co-insurance, and then your out-of-pocket maximum. This is a true worst-case scenario of your $4,000 deductible plus any and all copays. Your out-of-pocket maximum is still $6,500 as it was in the past. On your prescription drug card, it's going to be very similar to what you've seen. If you're able to go with some of the low-cost generics, it's a $5 copay. Your tier 2 drugs are a $35 copay, and your preferred brand name drugs are a $50 copay. No changes from what you've had in the past. However, with this is for any non-preferred brand name drugs or specialty drugs, it's just going to be a copay instead of a co-insurance. Some of these specialty drugs, I'd say if you look at anything you see advertised on TV, those drugs usually start out at about $100 a pill. $3,000 a month. You can go up from there significantly. I see a lot of these drugs coming in and $25,000 a month. Your worst case scenario would be either 105 or 150 for those. So that's your health plan in a nutshell. And I think the key takeaways here are no referrals, nationwide network, some additional upfront benefits, but overall, a really nice outcome compared to where we were with Harvard over the years. We've already worked through some implementation pieces with Cigna. They've got this boiled down pretty well. So we're very confident that everybody will have ID cards in their hand prior to the first of the year. I would encourage you, though, if you do have a prescription to fill and you've got the opportunity to fill it between Christmas and New Year's, do it while you have your Harvard card in hand. May as well let them pay the claims toward the end of the year. And that way, if there is some unforeseen event where you don't have your ID card in hand, you've got your prescription as needed. Angie, any questions on this slide?
Hold on, I just gotta, nope, not yet.
All right. So once again, really happy to see this outcome. And we were looking at a very significant rate increase with Harvard Pilgrim. So happy to have Cigna stepping up to the plate this year for us. A comparison of what you're currently paying to what your Cigna price is going to be. Your contribution, Angie, is this on a weekly or a bi-weekly basis?
Yep, this is the weekly cost for employees.
Okay, so your weekly cost as a single employee, it will be $53.12 for Cigna. Keeping in mind that this does go through on a pre-tax basis for you. For those people on the LP plan, very little change in price. Elevate Health, it is a bit of a jump, but we were looking at a much, much higher price through Harvard Pilgrim. You
Yeah,
guys would have been stunned if you saw that number. I'm not even going to share it at this
yeah,
point, but
it was very high, and that's why we chose to go in this direction.
yeah. For the employee and spouse, we're looking at a weekly contribution of $131. If you're an employee and child or children, it's 122. And if you're a family, it's 188.18. So for those people on the LP, very little change. For those people on the Elevate Health, it is a bit of a jump, but it also a significant increase in your benefits and should be a reduction in your out-of-pocket cost if you do utilize the care.
Yep, we do have a question. So chiropractic, I did look at that. It went from a $40 copay to a $50 copay, but still 12 visits a year. I did not look specifically at PT. I don't know if
PT, it's a combined 60 visits, Angie, and it is the $50 copay for
okay.
PT.
Yeah.
They combine physical therapy, occupational therapy, and speech therapy to a combined limit of 60 visits.
Okay.
So you could use all 60 visits for PT if necessary. So
awesome.
very, very nice if you're post-surgery or trying to avoid surgery.
Very good.
Any other questions?
Oh, hold on. I think one more just popped up. That's a great question. Is naturopathic doctors allowed on this plan?
They would have to be contracted with Cigna. I can tell you locally, most of the naturopathic doctors are not contracted with the health plan. So it would be very similar to what you've seen locally. I know there's Dr. Patterson's a pretty popular local naturopath, and he does not participate with any of the insurance programs.
Do you foresee that coming to fruition at some point in the future, or
I do. We're seeing the addition of a lot of what would be formerly considered alternative therapies, things like acupuncture and naturopathic doctors. I do see these coming into play more. And if you look at the statistics out there, it is more cost effective to include these providers because sometimes acupuncture can be a lot less expensive than a formal injection or surgery. And same with the naturopathic doctors. You can avoid a lot of surgeries and other expensive physical therapy. So we do foresee this changing and getting more common going forward. I can tell you the insurance industry in particular is usually well behind the curve of those things, but we are starting to see more traction in these areas, especially around alternative therapies.
okay. Another question was, is laboratory work covered or is that part of the deductible? Is there
Lab works would be covered in full under this plan, regardless of where you
fantastic?
receive it. So in the past, you did have to go to an LP facility. We were fortunate local that Lakes did participate, but this labs will be covered in full regardless of where they are done.
That's fantastic. And it's regardless of the type of laboratory test being done?
Correct.
Awesome.
And I should just mention on your health plan, as with Harvard, all your preventive care is going to be covered in full. So there is no copay for routine physical exam, routine OBGYN visit, routine child care visits, routine colonoscopies, flu shots, all those type of things that fall under the preventive care umbrella of the Affordable Care Act are going to be covered in full under the Cigna plan.
Fantastic. Is cancer preventative care included in that?
It all depends on the billing code. Generally not. If you have a family history of cancer or other diseases, typically the providers will use a different billing code than your regular preventive screening. So it would be subject to your copay at your primary care doctor.
Is there a way to ask the doctor to code it differently? I mean, I don't know if that's illegal or, you
Um,
know.
it is up to the doctor. Just to give you a little background on medical billing codes, there are over 30 million
Ugh.
different billing codes. I was talking to somebody at the hospital a couple months ago, and they're telling me there's now one for getting hit with space junk, being bit by a parrot, it's mind blowing the number of different services. You can ask your doctor, or you can ask your doctor to confine your routine physical exam to just ACA preventive care. It's a bit of a gray line on how these things work out, but it's certainly a conversation worth having with your primary care doctor. But the holy grail of all this medical stuff is it's an electronic claim that comes in on a billing code and gets adjudicated on a computerized claim system on whether it falls under that or not.
Okay. How is the mental health plan under Cigna? I know that you and I had talked previously because that was one of my concerns as well.
Yeah, $25 copay for mental health. You do have to see an in-network provider, but it is an unlimited benefit. So it's a really fantastic benefit
Good.
there. If anybody does need inpatient mental health or substance abuse, it is covered. The words they use are, quote, as any other illness. So if it would be subject to a deductible, typically for an inpatient stay, it would be subject to a deductible here. But mental health is covered on an unlimited basis.
Fantastic. Good to know. Now with the inpatient care, I know with Harvard Pilgrim, it was a once a lifetime benefit. Is Cigna the same with the inpatient?
It is. They do follow the New Hampshire state mandates for
Okay.
that. So no change with that.
Okay, great. Let's see. So I think that covered, the question was, is therapy covered, which I think is what we're talking about under the mental health. So that was just covered, that it's the $25 copay.
Okay, great.
Awesome.
All right, I will move to the next slide then.
Fantastic.
Next slide is a quick review of the Delta Dental premiums, and we are seeing a price reduction from Delta Dental this year. Fact of the matter is there was very little dental care incurred from mid-March to the end of May with the pandemic and the dental offices being closed. So Delta did reduce their rates for 2021. Not a huge rate reduction, but also not a bad rate reduction. The employee cost is going to go down by from 1364 to 1312. So very little change there, but once again, a slight rate reduction for anybody. A couple of things on your dental plan to keep in mind. Your preventive care is covered in full, so there is no out-of-pocket cost for your preventive cleanings and your scheduled x-rays. The other thing with Delta Dental is if you do need more than 2 cleanings per year, they have their HOW program, or Health Through Oral Wellness. If you're going to a participating dentist, you can talk to them about that. They will go through this. It's this little computer system or app that they go through, and they will score your oral health. And if you fall under a category, I think it's of a 3, 4, or 5. Don't quote me on that, but you can get extra preventive visits per year. So if you need an extra cleaning or 2, they can be certified and then covered in full through Delta Dental. So very nice benefit there. Any questions on the dental piece?
I don't see anything coming up at the moment.
All right. Moving on to the next slide. I'm sorry, I've got, looks like an oil delivery at my house. That's what I keep looking at. Big price savings here on the Delta Vision. It is going down by a penny on the single rate, going up by 2 cents on the employee and dependent, and staying the same on the family. The dental or the vision is a really nice benefit. You do have coverage both for vision care, but also for frames and lenses with copays there. And also if you have contact lenses, they do reimburse for contact lenses. I just had to order some new ones yesterday, and I can tell you I always forget how expensive the contact lenses are, but this is a really nice benefit. I will say with Delta registering on their website, there's some great information available to you there. You can see where you are in relation to your benefit maximums and what's been processed for claims. So I would encourage everybody to register on Cigna once you have your ID card, and then Delta also for your vision and dental plans. Any questions on vision?
Nope, not that I'm seeing.
All right. Most important pieces here. If you're on your current plan and not making any changes, we're able to do an electronic transfer of information from Harvard Pilgrim to an enrollment platform for Cigna. Are you requiring any paperwork from people if they're not making changes, Angie?
No, as long as Cigna's good with the information that we've sent them, then I don't see
Yeah,
a point in doing that.
yeah, there's an enrollment platform there. So if you are making any changes to your plan, this might be adding or deleting a dependent going on the plan if you haven't been on it previously. You do need to complete a Cigna application and return that to Angie no later than December 1st. So that's a hard cutoff date. We do have to submit everything to Cigna at the same time. And that allows everybody to have ID cards in their hands prior to the 1st of January. So no paperwork if you're not making any changes. If you are making changes, we do need you to complete a new application. And then with the Delta Dental, dental and vision programs, if you are making any changes there, we do need paperwork no later than December 15th. So if you're adding or removing a dependent, deciding to go on the plan, all those changes need to be made by December 15th. Any questions?
Yep, we have one question. Does Cigna cover any vision care?
Cigna plan does cover a routine vision exam. We did include that with the plan. It is optional. It's one exam every year with a $20 copay. So we do have Cigna Vision baked into the plan.
Fantastic. I was going to ask Bill, just because this is a short week, is there any way to extend that December 1st to December 4th, make it next Friday versus Tuesday, just to give people time to go over it with their families and then ask any questions that they may have before they change their plan?
There absolutely is. I
Okay.
think in comparison to our call with Cigna earlier in the week, I think we had developed this first, and I think they are giving us a little leeway.
Yep.
So December 4th is very reasonable.
Okay.
And it should not impact ID cards.
Okay, fantastic. What I am going to do, so everyone is aware, I am going to send everybody the form along with the information about the plan. I'm going to give you the full scope of benefits so that you know exactly where everything is. You don't have to sit here and try to remember everything that was said on this webinar. So you'll be receiving that today, and you only need to fill out the paperwork if you're changing your plan or if you're adding somebody to it, if you're deciding that you want to deny coverage. For those of you who aren't on the plan but were interested and have chosen not to, I do need you to fill out the form showing that you're denying it, because I do need that for ACA reporting, the Affordable Care Act reporting at the end of the year. So please make sure that if you're denying the plan, you do not want coverage, that you fill that out so that I know that you literally know that we have a plan and that you're choosing not to take it. It's important for us to have that information.
Yeah, critically important.
Right. Yeah. We don't need to be fined. It'd be bad. Let's see. So I think that's all for me. I'm not seeing any additional questions coming up. So this is fantastic. For those of you on the call, this was a 30-minute non-billable call. So please make sure you note that on your dailies, because there's a lot of people that aren't on this call because they don't qualify for health insurance. So Beth needs to be able to differentiate who was on the call and who wasn't. So please make sure that you note your dailies and your clock out forms accordingly. And I think that is all. I don't see any additional questions. If anybody would like a copy of this recording, please just let me know and I will get it out to you. Otherwise, we hope that everyone has a fantastic Thanksgiving, and we will see you after the break.
All right. Thanks, everyone, and happy Thanksgiving.
Thank you, Bill. We appreciate your time today.
Bye, guys.
Bye-bye.